Why should alcohol intake be limited for stroke prevention? Have you ever wondered how alcohol affects your risk of stroke? It's a question worth exploring, especially since strokes can have serious consequences. Limiting alcohol intake is important for stroke prevention, and here's why. First, excessive or heavy drinking significantly increases the risk of both ischemic stroke, which is caused by blood clots, and hemorrhagic stroke, which occurs due to bleeding in the brain. Studies consistently show that high levels of alcohol consumption are linked to a higher risk of all types of stroke. Heavy drinking can raise blood pressure, damage blood vessels, and lead to irregular heart rhythms, all of which contribute to a greater risk of stroke. Binge drinking is another pattern that raises stroke risk. This type of heavy episodic drinking significantly increases the chances of both ischemic and hemorrhagic strokes. In fact, binge drinking is often more harmful than steady moderate drinking. Now, when it comes to moderate drinking, the relationship with stroke risk is complex. Some research suggests that moderate drinking, defined as up to 1 or 2 drinks per day, may reduce the risk of ischemic stroke. This could be due to effects on blood clotting and cholesterol levels. However, this protective effect is not universal and can depend on individual factors like genetics, existing health conditions, and even regional differences. It's important to note that medical guidelines do not recommend starting alcohol consumption for stroke prevention. The potential benefits are uncertain, and the risks associated with alcohol, including stroke, liver disease, and addiction, are significant. Reducing alcohol intake is a safer approach. Studies indicate that lowering consumption from heavy to moderate or low levels is associated with a decreased risk of ischemic stroke. Interestingly, the type of alcohol consumed may also matter. Some evidence suggests that wine consumption might be linked to a lower stroke risk compared to spirits or beer. However, this could reflect other lifestyle factors rather than being a reason to drink alcohol for stroke prevention. In summary, limiting alcohol intake is crucial for reducing stroke risk. Excessive and binge drinking can have harmful effects on blood pressure, clotting, and vascular health. While light to moderate drinking may offer some protective effects for ischemic stroke in certain populations, these benefits do not outweigh the risks. Therefore, the best strategy for stroke prevention is to limit alcohol consumption and avoid binge drinking. Always consult with healthcare professionals for personalized advice regarding alcohol and your health.